The extent of the plaintiff's injuries. Non-economic damages aim to compensate the plaintiff for things like pain and suffering as well as loss of enjoyment of life. Therefore, the severity of the plaintiff's mesothelioma diagnosis and associated symptoms will impact the non-economic damages award. Plaintiffs with later-stage mesothelioma diagnosis or more debilitating symptoms tend to receive higher non-economic damages. The aggressiveness of the tumor growth and invasiveness of treatments needed like chemotherapy, radiation, or complex surgeries would also be considered. The plaintiff's life expectancy. Mesothelioma is an incurable cancer, but survival times can vary greatly case by case. Those with earlier stage diagnosis or healthier states may live 2 to 5 years or more after diagnosis, while others may only survive 6 to 18 months. A shorter expected survival translates to greater pain and suffering anticipated to be endured and thus usually correlates with larger non-economic damages. Expert medical testimony about life expectancy is crucial. The plaintiff's age. Younger mesothelioma patients tend to be awarded higher non-economic damages amounts. This is because they will likely endure symptoms and treatment over more years of their life. They will also miss out on more future experiences and years with family. For example, a 40-year-old plaintiff may be awarded significantly more than a 70-year-old given similar disease states and prognoses. The plaintiff's pre-illness quality of life. Evidence is presented about the person's activities, hobbies, relationships, and enjoyment of life before their diagnosis. An active, social individual full of plans may warrant higher damages versus someone already limited by other health issues. The traumatic impact and losses stemming from mesothelioma are weighed. Non-economic damages aim to financially compensate for the loss of life as it could have been without this disease. Evidence of pain endured. Pain levels vary dramatically between mesothelioma patients based on tumor locations and individual pain tolerance. Plaintiffs who undergo multiple invasive surgeries and procedures or experience chronic, refractory pain tend to see higher awards. Extensive medical records, testimony from treatment providers, and reliance on pain medications would factor in. Juries consider the physical and emotional toll that severe, unrelenting pain can take. Impact on familial relationships. Documents and statements are presented about how mesothelioma has impacted the plaintiff's role in relationships within their family. This includes any strain on assisting family, diminished time spent with spouse, partners and children, or difficulties participating in family activities and events. Non-economic damages aim to provide solace for such social and emotional losses. Occupational and financial impacts. Mesothelioma forces most patients into premature full or partial retirement from work. Evidence is weighed regarding job titles, lengths of careers, and prospective job opportunities or promotions that may have been derailed. Lost income streams contribute to lower quality of life. Financial hardship from medical bills, co-pays, travel for appointments or second opinions also eats away at what life could have been like without this untimely illness. Evidence of diminished mental well-being. The physical and emotional toll of fighting mesothelioma commonly gives rise to depression, anxiety, fear, and other mental health issues. Professional psychological evaluations and documented treatment histories help substantiate and quantify such damages. Poor appetite, insomnia, concentration issues, memory loss and social withdrawal further disrupt day-to-day functioning. Psychosocial deficits require compensation. Emotional testimony providing at trial. Plaintiff's testimony about their diagnosis experience, symptoms endured, fears and worries, sleepless nights, days in the hospital, losses and how their life has been irrevocably altered carries great weight with juries. A compelling personal account resonates deeply. Loved ones may also testify about watching someone deteriorate and/or specifics like administering injections, helping with hygiene tasks or household duties. The humanity of the situation can heavily impact non-economic damages amounts. The defendant's conduct. Was the exposure incident mere negligence or did actions display reckless disregard, intentional? To what extent was safety ignored or warnings about hazards withheld from workers? Gross misconduct often results in punitive damages on top of compensation, reflecting society's normative judgment. The more egregious the conduct involved, the more a jury may award to both punish and deter similar future behavior through the legal system. Comparable past mesothelioma case awards. Lawyers on both sides of a case will research verdicts and settlements from similar prior mesothelioma lawsuits based on comparable plaintiff profiles, tumor sites, causative exposures in the same industry, trades, defendant arguments and injury timelines. This data helps establish ranges for general damages expectations while allowing room for flexibility based on nuanced case specifics. Juries are aware that consistency and fairness matter in the civil justice system. Evidence limitations or issues. If key patient records or data are lacking or legitimacy concerns arise, this may negatively impact the perceived merit or strength of a case. Unanswered factual questions tend to correlate with lower damages. But alternately, if defendants introduce particularly weak counter-arguments or are caught attempting to conceal or distort data, a jury may award more to compensate for such tactics. A well-presented case typically fares better. A multitude of disease, injury, life impact and conduct factors determine non-economic damages awarded to plaintiffs in mesothelioma lawsuits. Both sides aim to compellingly illustrate how circumstances should properly be valued and remedies applied in each unique situation according to established legal principles and community standards of fairness. This helps ensure patients receive full and just compensation for harms caused through no fault